I think there's a tendency to think about scalability as just, okay, it has to be SaaS, it has to be software, otherwise it's not scalable. And that's not true. I think what happened to retail in that kind of 2000s era is what we're about to see in the 2020s in medicine. However, the stakes are a lot higher. I was on a obstetrics elective and I unfortunately ended up witnessing a stillbirth. And that really opened my eyes to just how huge the gap is in maternal health and how much more we need to do to support moms and babies.
Welcome to Keep IT Healthy podcast, the show hosted by people making things happen in technology, aiming to optimize healthcare delivery, health, well-being, and fitness. My name is Jan Kamiński and I'm the co-founder of AppLover, a company dedicated to improving the quality of life with IT solutions and digital advisory. We started making this podcast to amplify great thinking to propel healthcare forward. Today, I'm thrilled to have Senan Ebrahim joining us. Senan is the CEO and co-founder of Delfina, where he is dedicated to improving maternal health through technology and data-driven solutions. With a rich background in neuroscience, public health, and digital health innovation, Senan's work is at the forefront of transforming healthcare for expecting mothers. Stay tuned as we explore Senan's journey, delve into the challenges of building Healthtech products, and discuss the future of maternal care. How hard was it for you as a doctor to become a founder later?
Well, I think in many ways, like people make a lot about, physician founders and all that, but at the end of the day, I think it's all a common thread. It's basically looking into how do we break down a system, understand the root cause or etiology in doctor speak, like what is causing this disease, and then find the most fundamental cure or treatment that we can. And when you look at basically every software company or every technology company that was ever created, they were truly trying to solve and 10x improve some major issue in the same way that I think physicians do every single day, but at the scale of the system being an individual patient right in front of you. That said, while I see a lot of parallels in the way you think and the way you do things. I think the cultures are worlds apart. The ways that people work together are very, very different. And I think in many ways, the hyper specialization of medicine has been very challenging for a lot of physicians. I see for my wife herself, she's an OBGYN. But I think at the end of the day, for me, having a clinical background was not just a way of anchoring what I do in this space, like because I'm in maternal health, but it's also a way of thinking diagnostically, thinking critically, thinking differentially about what's really going on here, thinking causally. Do we really have the evidence to know that X is causing Y? And that's what I need to double down on. And so I think if you look at Delfina and the company that we've built, which I'm so proud of over the last 3 years, it really reflects that clinical mindset and that acuity and focus on, are we actually solving the problem? Are we actually treating the root disease?
How did you pick maternal health? I mean, it's a critical area, but how did it happen?
I went from neuroscience really into maternal health because I ended up witnessing a stillbirth when I was on my own obstetrics elective. And that really just opened my eyes to how huge the gap is, Jan, in the United States from what we're doing in the standard of maternal health care and what we could be doing with an AI-powered, doula-led, integrated system of care that really understands the risks before they actually emerge clinically at the level of a diagnosis and enable and support the pregnant patient herself to do whatever's needed, and enables her family, enables her care team, everyone surrounding her so that she can ultimately have a healthier outcome. And that realization was first just a professional one from when I witnessed that stillbirth, but it became a personal one and a real personal cause to me after my wife went through a somewhat challenging pregnancy herself. And we realized that even for us as two very privileged physicians, this is how it is. You have to go to the ED to get any level of reassurance about your pregnancy. And thankfully, our son is completely fine. And my wife in the end was completely fine. But at the end of the day, looking back on our experience, we thought, well, we have to be able to do better for all of our patients, because if it's like this for us, what is it like for a mom in Houston on Medicaid who has 4 children and is having preeclampsia for the second time? Well, it's going to be a lot harder for her than it was for us. And we got to make sure we build a product that works just as well for her as for every other patient around the world.
Could you walk us through on how the platform uses this data to improve the outcomes for expecting mothers? Because you mentioned data as a probably data-driven solutions, that you implement for maternal care. But I want to dig into that and see how you use it in practice.
So I would think of data as basically it's the future equivalent of the I would say like every single time that you went to the doctor and you got any data taken about you, probably as like let's say at the pediatrician, you were relying on that physician looking up something in a paper file or remembering to look something up in a paper file. The amount of data that we have now is just absolutely overwhelming. We've gone through that transformation in the last 10 years where clinics widely and hospitals widely adopted EHRs, and now we're just sitting on these mountains of data. And counterintuitively, it's actually sometimes made doctors worse because they don't know where to look. They don't know what to focus on. So, I think what we're going to see in the next decade and what we're proud to be part of at Delfina is creating a layer of insight on that data so that if you're a very busy OBGYN physician, you're not having to sit there and scroll through hundreds of thousands of data points instead of 10,000, like, wow, thanks for adding all this extra work for me. It's actually, no, here is the one insight or the 5 insights that you might need to know about your patient, synthesizing millions of data points of diverse types. So getting data from different sources. I'm really grateful for, the companies and health systems that went before in the last 10 years, and as well as the regulators who made it so that now, a company like Delfina, which creates massive value from our ability to render insight off of that data, this couldn't have existed 10 years ago. We were starting to collect the data, but there was no interoperability. They couldn't talk to each other. As recently as 2019, we had people taking couriers with printed out reports from one hospital to another in Boston in an emergency context. The only way to know what happened at the other hospital while you have the patient in a trauma setting or under trauma surgery is to have a courier deliver a paper packet in 2019. So how the world's changed in 5 years, I think COVID played a major role in that, but it's also the groundwork and infrastructure that was laid by the first generation of digital health companies.
What's your opinion on the AI and machine learning, obviously playing in the future of both maternal health and health tech in general? Because, for example, you mentioned those sets of data and new tech that's being the part of the discussion, but in the end, for example, the EHRs you mentioned are not AI enabled. I mean, they're not AI ready. The data isn't ready for all the bots that we might implement that. So, what do you think is what happened to, for example, retail 10 years ago? So the fast digitalization will happen to healthcare.
That's a really interesting parallel, actually, to retail. I mean, I think the disruption will be comparable. That the personalized kind of shopping experience that you're getting at Amazon from the comfort of your chair that you couldn't have imagined when you were shopping at a Walmart in 2005. It's really striking, I think, what we'll see in medicine being very similar to that in the next decade. I think what happened to retail in that kind of 2000s era is what we're about to see in the 2020s in medicine. However, the stakes are a lot higher, and no disrespect to any colleagues in retail, we love Costco, but at the end of the day, and there have been oversteps. In fact, one in pregnancy, there was a company that figured out an algorithm that based on what people were shopping for, they could actually predict who was likely pregnant. I mean, that's not the hardest machine learning algorithm in the world to build, as Jan. It's, they had a pretty high performance, but to what end? And what are the consequences? And so there was an incident where this young woman she was living with her parents, and she had her parents receive some flyer from this, or some brochure or some marketing from this company saying, hey, congrats, we think you're pregnant. And her parents being like, what? And it caused a bit of a privacy related incident. And eventually they completely rolled it back and said, what, we're not going to just predict pregnancy so we can sell you more stuff when it has these kinds of consequences. But I think in healthcare, I mean, there is all that and so much more, right? There's a privacy and security angle. In maternal health specifically, we're now living in an era where reproductive health access is compromised by legislatures in a lot of states. And so you have people living in, unfortunately, kind of a fearful situation where anybody getting any data about their pregnancy, especially when, 1 in 5 is going to spontaneously end in a loss, these patients are terrified. And so when you talk to them, you just really feel like it's our duty and our obligation as the company that is truly trying to save their lives by, analyzing this data. Our first mandate is to keep that data safe and keep it private. And so you'll look at the policies that we've adopted at Delfina, they're actually quite conservative for a technology company compared to, all the tech companies of the last decade. So what we've done is say, we want to set the standard. We're in maternal health. This is probably one of the most vulnerable populations, so one of the highest risk populations. We serve a lot of Medicaid populations, a lot of very diverse folks, and we're very proud of that. But we got to make sure that we are appropriately managing this access and making sure that the insights also from that access are only going to be used to advance and further the care of the patient, not to deny them care, not to in any way negatively impact their health or their general livelihood.
With this being said, the regulated areas, you mentioned maternal health is regulated differently. So my first question is why, and how do you navigate, in your company, the complexities of both healthcare regulations and patient trust that you just mentioned?
Well, I think the patient trust comes first because, if there was a regulation that said don't do something and there was a patient overriding imperative that said do it, we would go to the regulator and say, hey, look, this is what patients are saying. But typically the regulators are generally in alignment, I will say, in our space with what patients want. And they are saying things that generally make sense. Sometimes they're a little delayed. Like, for example, this ONCIT rule that I referred to about interoperability. At my previous tech nonprofit that I had started, Health, where I'm still the board chair, we created a free and open source EHR that's now used around the world, in dozens of countries, by hundreds of thousands of patients and their care teams. And at the end of the day, it was a real struggle to even have, an Epic deployment that's in Beirut, Lebanon, see data about Syrian refugee patients that are being seen in our system. And the block wasn't coming from us, let's just say. So at the end of the day, I think that ONCIT rule is a great example. It should have happened a lot sooner, ideally in conjunction with the ACA incentives to adopt EHRs, because it would have made it so much easier then for a whole, not even just companies, but like physicians themselves to start building some of these algorithms and adopting some of these smart workflows. And that didn't happen because that ONCIT rule didn't kick in until a few years ago. So I'm really excited to see like a regulatory environment that's like really up to date and in lockstep with like where the technology is. But I really would always put the patient first anyway. So as a company, we are the type of company that does better actually in this environment where there are regulatory constraints on what you can and cannot do. And that really sort of draws the delineation around patient safety. And then we're able to exceed that with quality, where we can deliver even better outcomes. We first do no harm to the patient compared to the baseline, and then we're able to do even better. So in that kind of an environment where they're the umpire and they're actually saying, okay, you can't play foul, Delfina really thrives in that environment.
Okay, and on the side note here, because you said, you mentioned the EHR, the open source in the EHR, since obviously the market is monopolized by two companies, how did it, what was the strategy? How did it go with the open, because it's such a cool idea. There is a thing called, I think, Open EHR, currently with a few, I think like 5,000 stars on GitHub with the community, but like how did it go with your EHR?
Yeah, so there's Open EHR. There's also Open MRS, which was kind of the OG in our space. They were in like 2006, I think. They had, a system that ultimately has a very strong backbone and infrastructure for like a hospital or a large health system. We were working, largely with smaller clinics at the time at Health, and even now our organization really focuses on smaller clinics. There are some larger ones and larger organizations that are, like Med Global, for example, that has clinics around the world, might serve millions of people. But in an individual deployment, like in the Rohingya refugee camps in Cox's Bazar, Bangladesh, they're serving, 25,000 people with, 20 physicians, nurses, and community health workers. Small staff, small patient volume. They don't have enterprise IT support. They want something lightweight, works on their phone or works on a tablet, works offline when they're going through the refugee camp. So it was quite a niche, I would say, where we started, but we were actually quite surprised. For example, you referenced how locked up the EHR market is here. It's true, but we still find some practices. We work with some practices at Delfina now that still don't have an EHR. Really? And you might be thinking, how's that even possible, right? And also, why might they have not adopted an EHR? Well, an EHR actually slowed them down. A lot of them heard from other people that took on the meaningful use from the ACA, and they were like, well, it just made me less efficient and worse at my job of actually serving patients to sit there for 3 hours and document. So what Delfina does is we come in and say, look, all that overwhelming documentation burden, we can help you solve that. We can help you document. We have all of these speech to text and dictation type solutions, just like everybody else now. and we stack really nicely with whatever your EHR is. Or if you don't have an EHR, we can help you get on one. And you will no longer have to sit there scrolling through it all the time to figure out what happened, like a ledger. It'll be more like like an assistant. It'll be someone there to direct your attention and focus to what you need to be doing right now for this patient. So they've really liked the paradigm of Delfina. And to be quite frank, I'm surprised that a lot of legacy EHRs have not actually done that yet. I think that might be where they're going, but the incentives are a little different for them. They don't necessarily thrive on keeping their their provider users happy. And even at Hikma Health, frankly, I see where that comes from, because we would have, the clinic director say XYZ, and then the other person says, no, how about X prime? Actually, no, how about ABC? You just have too many stakeholders, and you can't actually end up building something that just delights the user. Whereas at Delfina, we just said, forget all that. We're going to start with the person who's actually seeing 30, 35 pregnant patients a day, who's on the front lines of the pregnancy maternal health crisis in this country. And we're going to help them take care of their pregnant and postpartum patients better. And then we'll go up to their enterprise people and say, okay, look, your providers are using this, they're loving it. The patients are using it, they're loving it. And this is what we built. This is what it is. We're not going to hyper customize some random thing for you. This is actually the product that your providers want to use and your patients are loving. And it's actually making you more efficient at delivering healthier outcomes.
How did your product pivot? In a sense, did you start right away with the Maternal platform that you have currently, or was it different before?
When we first started the company, Jan, we thought, well, look, we have the kernel of a great technology here, and we just want to get it out there. So why don't we just make an API and serve it to everybody's EHR? And I talked to a mentor of mine who was kind of like, yeah, nobody's going to use that. Nobody's going to just use random software. You have to get in here in the trenches with us and really build that out. And so, and now, by the way, that mentor is our chief medical officer. She's Dr. Bonnie Zell. She's a legend in healthcare. She's done a lot in quality and safety and was a previous telehealth founder as well. So, when we brought her on, it was we really understood that we had to not just render really high performance predictions and expect people to act differently off of them. We had to build a system of care around that, so that when we have a prediction that someone is at risk of gestational diabetes, what do we actually do about that? And actually, in clinical medicine, we're not amazing at that. What we just tell patients, okay, sorry, you're going to have, now you have GDM, is the way we do it in the standard of care. And now you should follow a 20-gram carb diet and you should exercise. And then 80% of patients just don't really do it. And then we're like, sorry, you had really bad metabolic health outcomes. That's the typical sequence in the standard of care. Now, there are some clinicians who really try, go above and beyond, and develop the diet or refer you to a dietitian. But most of the time, it's not what's happening. So with Delfina Care, we said, let's actually have registered dietitians ourselves, that if there's a prediction that someone's at risk for gestational diabetes, we make sure they see the dietitian at the clinician's discretion. And that dietitian is working with them on a culturally competent diet. So instead of just being told, hey, why don't you go eat a 20-gram carb diet that nobody knows, I don't know what that means, or I don't know how many carbs I can have for that. A dietitian actually sits with them and says, okay, you're preparing dinner for your whole family. This is how you can portion it out with the same food you're already eating, less tortillas, less rice. Those, food is so culturally informed that so many patients were basically telling us, yeah, I just can't adhere to whatever my doctor's telling me. So now you'll find that Delfina Care members actually love their doulas, the registered dietitians, the human side of the platform, which has really grown and evolved into this beautiful system of care over the last 3 years. And a lot of credit really goes to my co-founder, Priyanka Vaidya, who had that vision of, instead of building just a software system that serves, which is initially what I'd called her about, instead, why don't we actually meet these patients where they are and do everything that they need? If we can deliver better care earlier, if we can wrap around the existing system of care while closing the loop directly with it and continuously and dynamically support these patients, why wouldn't we? That's how we solve the crisis.
And what was your biggest learning on that journey of pivoting the product?
I'd say that, I think there's a tendency to think about scalability as just, okay, it has to be SaaS, it has to be software, otherwise it's not scalable. And that's not true. There's, I'd say Kaiser is an excellent example of a old school brick and mortar, founded in the 1940s, I believe, health system that's highly scalable. And they know how to take what they've done successfully in the East Bay and replicate it in the South Bay. and then in Southern California, and then in Hawaii, and then in Colorado with permutations. So when I think about scalability in healthcare, technology is an amazing enabler of scale. But if all you build is just technology and you drop it somewhere, you're not going to actually scale anything. So, and on the other hand, if you just take manual processes and you try to replicate, in the 2020s, you can't do what Kaiser did in 1940. So I'd say today, when I look at healthcare, technology is the key to building scalable systems. But I was initially, if I could go back 3 years, my mindset was I was over-indexing on, technology being the only way and the only thing that can create the impact. When it's really a 1-2, the technology frees up humans from wasting their time and tees up the humans to do exactly what we do best. Because every single member I've ever asked anything, Jan, they don't say, "Oh wow, what an amazing prediction." They say, "Wow, what an amazing doula and what an amazing registered dietitian who helped me with my blood pressure cuff and helped me through my diet, etc." And that's really the key to Delfina's success is, yeah, we have the predictions and the foresight. That's what makes us different from everybody else. But we don't just predict it and leave you hanging there. We say, we will support you. You're a patient. You are a provider. You're a health plan. You're a community member, a family member who's supporting this person. We will get you involved and we will make sure that you know what you need to do to make sure that this outcome ends in a happy baby going home with mom and not one of the hundreds of thousands of tragedies that we're seeing in the US and millions that we're seeing worldwide.
How do you envision the future of healthcare delivery for mothers? Because we talk a lot about technology and how it's changing things, but what does a fully optimized, tech-driven maternal care system look like to you? Of course, ideal world.
Well, the ideal world, I'd say, is what we're building, and it's currently in place for people around the country. But when I want to extend it further, if I think 5 years out, what we built today is basically when someone is pregnant, she's able to receive this extremely personalized, data-driven, proactive system of care, and it extends up to 1 year postpartum based on our continued understanding of her risks. When I think about what Delfina can do long term, I also think about all of these folks who may be experiencing metabolic and cardiovascular challenges later in life. And when we took care of them in their pregnancies, we just got a very rich data picture of, they were physiologically stressed during a pregnancy. Well, if they're physiologically stressed later by, cumulative aging, we probably know how things are going to go. And I've seen all of these stories of patients who have type 2 diabetes that had gestational diabetes. In fact, it's about half of them. Half of the folks who have had gestational diabetes will have type 2 diabetes in their lifetime. So if we can get ahead of that, when someone is in her 20s, 30s, or 40s, before we start hearing about it in her 60s, well, that's something that, I'm very passionate about. I saw my own mom struggle with breast cancer and then a lot of, related health challenges later on in life. And so my vision for the future is looking at the gap in women's health and saying, well, there's a lot of things that, we just copy paste what we did studies on men in the 1900s and said, well, okay, let's just dose it down by about a half and assume it'll work. And while women live longer than men, the healthcare system does a lot less for women than it does for men. So my long-term vision is that women who go through our proactive, personalized system of care, where they are more likely to have a healthier pregnancy outcome, can then also benefit longer term from personalized primary care, personalized metabolic and cardiovascular care that's not just built for women, but for her as an individual patient based on what her clinical needs are, informed by that deep glance at what was going on during her pregnancy, which is so predictive of what might happen later.
I mean, except for the platform, do you also have your own clinic?
We do not have our own clinic. So we are a technology first platform that can scale into any clinic. So we have clinics around the country who work with us and use our system, but we don't staff our own brick and mortar clinic.
And as a company, you're bootstrapped or VC funded?
We're VC funded.
Okay, because I'm asking, what's the next step for Delfina? Because your client it's not B2C, it's a B2B business, right?
Well, so it is accessible to anybody, and we've had, without any marketing spend, basically, we've had hundreds of people download the app and peer refer and all that. But the vast majority of our usership, thousands of folks have come to us via B2B2C, where we work primarily with health plans, health systems as our customers and our partners, and they then help us get, at a time, hundreds of members into our care system, with the promise of them being able to see better outcomes, more efficiency, and ultimately lower total cost, lower utilization of some very, very challenging and advanced services like, NICU stays, where, if a baby goes to the NICU, we're going to see, about a $200,000 bill off of that. So if we can avoid that NICU stay entirely or shorten it, well, that's the crux of the value proposition of Delfina. And that's what we've been proven out in the market over the last 3 years is that, yeah, when you use Delfina, you see those reductions. You see those costs come down. You see those adverse outcomes come down. And you see better efficiency from your providers. You see happier patients. You see happier providers. So if you're a health plan out there and you happen to hear this, I think maternal health, we all know it's a national crisis, but it's also really a big part of our spiraling costs in healthcare. And that's really our vision for the next stage of Delfina, is to take what we've done very successfully with a few dozen partners and scale it up to be the standard of care that every single health plan, every single health system, just like everyone is offering, basic interventions for cardiology. This is level one. This is the entry level. What every single patient deserves is personalized care in pregnancy, not a copy paste. And so we're going to make that the standard of care. And then we're going to progress to our eventual vision of personalizing care throughout life based on what we've learned in pregnancy.
Yeah, I mean, personalized care probably is a trend across various areas, not only maternal care, right? But
yeah,
as you look at your platform currently, do you want to expand to other areas, or for now you specialize maternal care and that's the goal?
We think about it as focused rather than specialized, John. I know I was criticizing hyper specialization in medicine, and here I am running a pregnancy company. But I think at the end of the day, look, there's a maternal health crisis, and it needs to be solved by people who are laser focused and just working around the clock to make this happen. And I do think, I really commend a lot of the work that's happened in fertility, the work that's happened in menopause. There's a lot of really exciting work happening in women's health generally. But when we look at what we're able to do with our machine learning algorithms, we had to bring this right into maternal health and scale this with a very focused solution. That's how we're going to create and, really deliver the solution to the maternal health crisis. And it's not by extending a fertility solution, just like somebody else, other 8 companies that have great fertility solutions over the last 10 years. Could we partner with those companies? Yeah, absolutely. We welcome that. But our real ability and our unique insight is that we can help transform pregnancy care from being the disaster that it is today, the public health challenge of our time, into something where, the average patient coming in to see her obstetrician can celebrate her pregnancy, can rest at ease, can sleep easy, knowing that we've got her covered.
And do you think about other markets, or it's too early?
We're focused primarily on the United States. We're having some conversations in other countries where, I have a lot of international experience from Hikma Health. And there's certainly been a lot of interest from, countries around the world where, the maternal health crisis is truly global. That said, the health system, as well as, the physiology is the same. We're all human beings, and preeclampsia is everywhere. But the specific challenges that people might be encountering on the basis of, infectious disease prevalences in some nations, there's going to be access issues even at a whole different level than what we've seen in the rural United States. So we really chose the United States, besides being an American company, because the spend here on maternal health does not line up with the outcomes we're seeing. We are seeing outcomes that are on a national scale, ranked in the 50s or 60s, but we spend the most on maternal health per capita. So it's kind of like, how is that possible? We're actually spending all the money and we're doing the worst. So that's why we came here, because of that mismatch. And we're going to look for similar mismatches throughout the market, because what that probably means to us anytime I see that chart is like, okay, this country is probably spending a lot on NICU stays and maternal hospitalizations and scrambling to fix the problem when it's too late. And if they have a solution like Delfina that can give them foresight early, we'll work with whoever the risk-bearing entity is, whoever pays the bill for that in any country around the world. And I'd say on the timescale of the next 5 to 10 years, I expect Delfina care to become not just the standard of obstetric care in the United States, but truly global standard of how we take care of moms and babies.
So I want to talk about the product. You've been developing the platform for 3 years now, and I'm sure it's been there's been some challenges with that. It's probably backend heavy, data driven, things like that. So I want to know more about the challenges you had and how did you overcome them.
Yeah, so basically, I mean, we're about 3 years into the journey, and the first year and a half, we're basically building the product. I mean, it's a very intensive product. It's a product that needs to be safe and rigorous. We validated all of the machine learning models with our partners at Mayo Clinic and elsewhere around the country. We were recognized by the NICHD for having the highest performing as well as the most equitable models to predict hypertensive disorders of pregnancy. So a lot of that clinical and scientific validation and R&D, we weren't going to put something out into the world until we really had that done. So it's really been over really the last 2 years that we've fundamentally had the product in market, and we've been iterating and learning quickly. And where we're at now is we have, I would say, the richest offering. We have the most comprehensive offering, where from the predictions that our machine learning system is identifying folks at risk, we are intervening earlier than anybody else possibly could know to intervene, because we spent the time building these machine learning models, clinically validating them, building the workflows with our partners. And so now we're sitting on this extremely valuable platform that we've built. And our goal is really just to scale it, to get this in the hands of as many folks around the country and eventually around the world as possible. I'm happy to share a story of a member who actually had a attributable life saved to Delfina care. Well, it was really the life of her baby, because this patient was coming in, she was on a Delfina blood pressure cuff because she'd been identified as high risk. And this was a patient that her physician, Dr. Cynthia Rios, had said, if I didn't have Delfina, I wouldn't have known at all that she was high risk. So basically, it's only because of Delfina that I had her in this high risk paradigm, and I was using the blood pressure cuff. And then at 30 weeks, she started having some concerning blood pressure tracings along with, her general risk picture that, again, Dr. Rios was only tending to because we had put it on her radar that way. And at 30 weeks, so the patient comes in and, Dr. Rios starts really tracking her. And then around 31 weeks, she actually decides, we really have to induce and deliver you. And so we heard about that, and we were tracking it. We're wondering what's the outcome going to be for this poor mom and this baby that, had this, because she was trending into preeclampsia, which is just such a debilitating complication that we can't let it happen. We have to induce. But now this baby was born super early. So we weren't really sure what to think of it and what was going to happen. And then Dr. Rios got a call from the neonatologist. So she then called Dr. Bonnie Zell, our CMO, and she told us, hey, the neonatologist just told me that he said, if you guys didn't have Delfina, there is no way this baby would be here. This baby would not be on Earth. This baby would have passed in utero, in the womb, if it weren't for Delfina. So that was, to me, the most electrifying moment of the whole company, where that was our first life saved. We call that baby Adam. And if you looked at how we saved his life, it's basically that without Delfina, they would have just waited. They wouldn't have even had her in the high risk workflow. They would have just waited until they see her at the 32-week visit. And by that point, according to the neonatologist and the consensus with the OB, is like, yeah, this baby would have probably been lost. And so it was a really, for me, having seen that stillbirth, for Dr. Rios, where she had seen many challenging pregnancies in her career, it's just such a gratifying moment to have that mom come back in, for a postpartum visit or for her next pregnancy, or to say, thank you. Like this, yes, I went through this with my NICU stay and my baby and all that. But at the end of the day, I know, and I've heard from all my doctors, that the only reason we're here with baby Adam is because of Delfina.
That's amazing. I mean, probably even from the motivation perspective, as a founder, I would hear a story like that. Come on, that's impactful.
That fires us up, Jan. That's the wake up call at 5 a.m. That's like, this is how it's done. And there's no going back now. Before baby Adam, it was like all theoretical and like, yeah, great. We have a cool system and great technology, and it'll probably really help a lot of people. There's that the company arc in my mind is before and after. Before, we were already pretty hardcore. After that, there is no going back. Like, this is the focus of my career, and what I want to accomplish is to give that magical feeling of having a healthy baby that you can take home instead of a baby that passes, or a mom that passes. There are tragedies on the other side of this as well, where mom is lost. And so, taking away that just awful Hobbesian choice of obstetrics of like, what do I do for mom or baby here? How do I balance it? Just give everyone total clarity for what's the best thing here, and then go back to mom and let her decide, what do we do here? But with total clarity, rather than the kind of, oh, I think maybe, that kind of standard of care.
Yeah.
So I'm really excited to bring that to really every single person on earth, because that's what our moms deserve.
If you were to give 3 pieces of advice to other health tech founders slightly earlier in their journey, what would those be?
Jump in, just do something. I learned I learned a lot from my MD and my PhD that I think are quite obviously directly relevant to Delfina, learning how to do, machine learning based physiology prediction at my PhD, which is literally what we're doing now scientifically. And we're a very clinically oriented company, as I shared on. But at the end of the day, I think I learned more from Hikma Health and operationally trying to build technology and get it out into the world, dealing with all the scrapes and the challenges and seeing around corners. That experience was, I'd say, by far the most informative to what I'm doing now in so many ways. And before that, I had a few other kind of smaller ideas that I had pursued, and I think I wish I'd pursued more of them more fully, because I've never regretted, even Hikma Health or anything else. I've never regretted, oh man, I spent time on this or whatever. It's always been, wow, like this was a great learning experience. And with Hikma Health, I've still been able to impact hundreds of thousands of lives and hopefully scaling to millions. And with Delfina, hopefully eventually billions. So that's the goal, is like, but you got to start somewhere. So I'd say if I'm talking to any health tech founders who might even be in college, you don't need to be a doctor. You don't need a medical degree to start contributing. This is human health. You're a human being. If you have an idea, get after it, start learning. You'll never regret it.
Thank you for sharing this. And thank you for joining today and sharing your story. Where can our audience find you?
Delfina.com. Delfina with an F. Delfina. Delfina.com. Check us out. We're on all the major socials: LinkedIn, Twitter, Instagram, TikTok for our Gen Z friends. I got my Stanley mug right here for you for Gen Z. Cheers. We love engaging. We love engaging basically with anyone in the community. Look, I was in Dallas last week at the American Heart Association, met with a ton of different folks from all around healthcare, all around different communities in the Dallas area. We love hearing from you. We're solving truly what's a national and global crisis, which affects everybody. About half of people on Earth will be pregnant at some point in their lives.
Right.
And the other half of us, well, we're still born at some point. So this is one of the most, that's what I love about what we do, Jan. It's like I sit next to somebody on a plane and they're like, oh yeah, let me tell you about my pregnancy. And so anyone out there who's listening, check us out, delfina.com. Give us some love on socials. We'd love to hear from you. Feedback. What are we doing right? Who might we be able to help in your communities? Engage with us. We'd love to hear from you.
Stay in touch with us. Subscribe to our podcast. Give us a like, comment, or share. If you want to reach out personally, you can find me on LinkedIn and Instagram.